Good morning, one and all. Today, we are going to deal with the topic occupational hazards in dentistry. These are the following contents. They are introduction, history, types of hazards. They are biological hazards, physical hazards, chemical hazards, and psychological hazards. And how to control the biological hazards, chemical hazards, physical hazards, and psychological hazards we are going to deal today. And the topic we are going to deal in the next class is the ergonomics in dentistry in continuation with the hazards in dental field. They are the musculoskeletal disorders, types of musculoskeletal disorders, dental risk factors associated with musculoskeletal disorders, intervention, and conclusion. Coming to introduction, occupational hazards can be defined as a risk to a person usually arising out of employment. It can also refer to a work, material, substance, process, or situation that predisposes or itself causes accidents or disease at a workplace. Occupational hazards can occur in the form of biohazards, neuromusculoskeletal disorders, health hazards like disruption of the respiratory and cardiovascular system, hearing impairment, visual problems, allergies, and skin diseases. Dentistry is one of the careers which have so many occupational risks for dentists and dental staff. Dental professionals are predisposed to a number of occupational hazards. These include exposure to infections, percutaneous exposure to incidents, dental materials, radiation, noise, musculoskeletal disorders, psychological problems, dermatitis, and respiratory disorders. Close contact with the patients, especially with the saliva and the blood, exposes the dentist to occupational biohazards, mainly which are of contagious kind. Strained posture at work destabilizes the osteoarticular system and causes overburdening of the spine. This overburdening might affect certain groups of muscles and joints, especially in the spine and the cervical regions of the neck. Coming to history. The history of occupational hazard awareness can be traced back to the 18th century when Bernardo Ronzini, who is referred as the father of occupational medicine, recognized the role of occupation in the dynamics of health and diseases. Coming to the first, biological hazards. Exposure to biological agents, especially regarding the blood and the saliva of the patients through contaminated needles and sharp instruments like orthodontic wires and also surgical blades, which might be the first biological hazard which might be exposed to the dentist. Exposure to respiratory infectious diseases through droplet transmission, including splatters from body fluids and projectiles while using high-speed devices like the aerators, scalars, and exposure to respiratory infectious diseases through airborne transmission is the most commonest feature of biological hazards to the dentist. Exposure to the environmental biological contaminants like the ventilation systems and the water through the three-way syringes is one of the factors which the dentist might be exposed to the biological hazards. Some transmissible diseases currently of the greatest concern in the dental professional are the HIV, that is hepatitis A virus, B virus, C virus, and herpes simplex virus, influenza, and fungi. As you all know, the most dreadful disease that has occurred in the past few months back is the coronavirus, which is also being transmitted through droplet transmission. Legionella. Legionella is where the operational area of the dentist, the microorganisms which might be proliferated through dental water lines. How to control the biological hazards? Like the first thing, we should have the proper medical history of the patient and the equipment to minimize the aerosols, like using of rubber dams, high-speed evacuation jets, so that we will not be contaminated through the biological aerosol, and also availability of the containers for disposal. Proper disinfection of the instruments and decontamination of the environmental surfaces, lab supplies and materials, and maintenance of the proper ventilation system and early cleanup of the spilled particles, and also regular testing of the water lines, which might be reducing the infections like the biological hazards to the doctor. Now, we have seen regarding the control of the biological hazards, how to protect ourselves. They are being done by PPE. They are personal protective equipment. The gloves, face masks, and also eye should be protected through the splashes or splatters as possible. Gowns or uniforms should be changed daily when they are being contaminated. Coming to the second one is the chemical hazards and its controls. Dentists are more exposed to various types of chemicals that are hazardous while providing care. These include, especially regarding the amalgam, like the mercury, silica, and powdered natural rubber latex glosses, and also beryllium, which are being the most dangerous agents of these is the mercury. As I said, mercury is one of the most commonest exposure in the dental field, that is, while using the dental amalgam, which has been an occupational exposure to dentists. The maximum level of exposure considered to be safe is 50 micrograms per cc of air. Mercury poisoning can be characterized by tumors of the face, arms, or legs and may be associated with progressive tremulous, illegible handwriting with slurred speech. As you all know, the Amanita disease is one of the exposure of the mercury which has been occurred in China by eating the fish. It causes ataxia, impairment of speech and hearing, and also it also causes with the high toxicity of the mercury like acrodynia, that is the pink disease, which causes pain and pink discoloration which can be observed on the legs and the hands. How to prevent the mercury poisoning? Using of precapsulated alloys, good ventilation, excess or spilled mercury should be collected in a break resistant bottle so that we can take care of the spilled mercury also. Inhalation of dust containing free silica or silicon dioxide in the ceramic laboratories leads to silicosis. It is one of the commonest factor of the dental laboratories exposure. Some of the dental alloys containing beryllium, and if it is inhaled while working with the items of the dental crowns, bridges or partial denture framework, they can cause chronic beryllium disease. Formaldehyde is one of the chemical agents that is being routinely used in the clinical setup for mainly in the disinfection of the operatory area. Liquid or vapor forms of the formaldehyde may cause severe abdominal pain, nausea, vomiting, and also eye irritation. The efficient barrier for most of the pathogens, that is the commonest thing which is used by every dentist, is the latex glosses. But most of the professionals are allergic to latex content of the glosses also. Airborne water particles which is present in the gloves might be causing asthmatic allergic reactions or even anaphylaxis. Dental personnel should also note that latex is present not only in the glosses, they are being seen in the personal protective equipments like masks, eyewear, and clinical gowns. The clinical symptoms of latex allergies include urticaria, conjunctivitis, accompanied by lacrimation and swelling of eyelids, mucous rhinitis, bronchial asthma, and anaphylactic reaction. Most allergic reactions can be managed by self-medication or prescribed medication. Sufferers from latex glosses, nowadays there have been availability of the vinyl, nitrile or 4H glosses which are being with latex free. Methacrylates. Dental products such as acrylics, resins and polymer materials used in the restorative industry represent a major advance in dentistry. But these products also may act as allergens in part of the population, like causing of allergic reactions including anaphylaxis, irritation of the skin, eyes, allergic dermatitis, asthma, headache, nausea and fatigue also. Xylene. Xylene is one of the chemical component which is mostly used in the clinical setup for spallation process. The dizziness, headache, mental confusion after inhalation of the vapors of xylene is the commonest feature being seen when the sterilization process is completed. Eyes and mucous membrane irritations will also occur from the vapor and liquid forms. If it is being inhaled in a chronic condition, it might lead to leukemia also. How to protect ourselves? By using gloves, eye protection and face shields in case if we are going to be mostly risked for exposure to the xylene or methacrylates or the chemical components. Respirators are also used as a PPE. They are personal protective equipment. Coming to physical hazards. Ionizing radiation. Ionizing radiation is one of the physical hazards, mostly with the diagnostic radiographic machines. The most radiation hazard that has been occurred in dentistry. Other sources are with the physical hazards are the UV light that is being especially used in the composite curing and also lasers nowadays. Intraoral and panoramic radiographs that are being widely used nowadays are safe enough of the advancements that is made with the improper ionizing radiation. Cephalometry is thought that is one of the more hazardous radiation at higher level. Radiation induced hazards. The causes are due to the radiation induced hazards are acute erythema, dermatitis, chronic skin cancer, bone marrow suppression, and damage to the eye including cornea. Radiation effects are cumulative and this damage is totally painless yet life-threatening. As you all know, uneven or unnecessary exposure to radiation might lead to the risk factor of causing the cancer. The study conducted among Canadian dentists has an occupational doses of ionizing radiation of the dentists and the dental workers has decreased markedly due to the advancements of making the ionizing radiation in the safer dose. What are the effects that are being most commonly seen of the radiation exposure are regarding the genetic factors. They might damage the reproductive cells, damage for the succeeding generations, and also genetic mutations might occur due to this unnecessary radiation exposure. Exposure to ionizing radiations can be minimized if radiation protection recommendations that have been outlined should be strictly followed. That is, ensuring the safety of the X-ray machine by regularly having the professional maintenance, use of accurate timer, use of sound professional judgment so that we will be not exposing the person or we are not exposed to unnecessary things. Use of lead aprons for not only with the patients as well as the doctor. Wearing of radiation monitoring device so that we will be careful enough of how much exposure we have been exposed. Noise. Dental personnel are exposed to noise of different sound levels while working in the dental clinics or laboratories. Dental laboratory machines, dental handpiece, ultrasonic scalers, amalgamators, high-speed evacuation devices, and other items produce sound at different levels, which is appreciable. But we should have the recordings of how much exposure with the noise should be seen. There are high-speed handpieces like 70 to 92 decibels is the appropriate measurement of the exposure, or ultrasonic scalers or cleaners, store mixers, or the low-speed handpieces should be less than 80 decibels of noise. Methods of prevention and control of noise exposure. That is, avoid use of aged and worn out equipment, regular maintenance of devices, proper acoustic treatment like sealing of the walls, floors, using of earplugs. Distance should be made like 35 centimeters with the device and the ear. Activation of equipments only during procedure should be done. Compressors should be placed outside of the dental office in an isolated area. Periodic audiometric evaluation for early detection of not having the deaf condition. How to control not only the physical hazards and also the chemical hazards like cuts from sharp instruments, like avoid use of sharps when not required, proper storage of the sharps, safe work postures, burns while handling like the heat sterilized equipment, and also exposure to ultraviolet radiations when curing, exposure to laser beams during dental procedures, fire or physical injury with damaged or dropped or mishandled gas cylinders should be avoided. Coming to psychological hazards and its controls. What are the psychological hazards that have been most concerned are depression, anxiety and sleeplessness, stress related to excessive workplace stressors, stress related to work-life conflicts, abuse by clients or members of public, abuse by co-workers, techno stress or hazards related to the impact of aging workers is one of the most commonest things that have been in the psychological hazards. How to prevent the psychological stresses? By taking sufficient rest, allot time for social interaction, and allot family time. And also, nowadays there are various courses that are available. They are yoga, meditation, which lead to relief from so many psychological stresses. Thank you.